So just given these promising findings, at least in terms of being able to address modifiable risk factors, we are doing multiple other ongoing studies. So the NUTRIVENTION 3 study is looking at MGUS and smoldering myeloma, all BMI, so all body mass index patients. And this study is currently enrolling in New York at Memorial Sloan Kettering Cancer Center and at Emory. So patients with MGUS or smoldering myeloma, as long as they're within the US, and if they're interested in enrolling, can reach out to me or my team. And in this study, they might need to come to one of these sites about 5 to 6 times spread over a year, but we can work with them to figure that out. And then we have another study, the NUTRIVENTION 2, which we're doing in partnership with the HealthTree Foundation. This study can also enroll MGUS and smoldering myeloma patients, and we're doing a short intervention of different diet and supplements to understand the effect on the microbiome. And this allows patients to take part from anywhere within the US, but they don't need to come physically to any site, and they can do this straight from their home. So if you're interested in that, go to the HealthTree Foundation website to sign up, or you can again reach out to me or our team, and we can guide you and direct you to the right place. And then lastly, some exciting news is that we got funding to do a newly diagnosed study with dietary intervention. So hopefully later this year, we'll be opening a study looking at how diet affects newly diagnosed myeloma, and there'll be an intervention arm and a usual care arm. So look forward to that as well.